Hi everyone, welcome to the new episode of our show where we're going to be covering AI in healthcare and especially AI in healthcare and remote patient monitoring, RPM. And it's my pleasure to introduce our guest today, which is first one is Omar Chaudhary. He's an expert in AI, and Omar Ahmad, he's trying to leverage AI in his products and in the business that he's building. So first, let's welcome Omar Chaudhary and let's hear from him and his introduction.
Thank you very much, Gleb. Thank you for having me. I have about 18 years of experience in information technology and specifically in data analytics and machine learning and artificial intelligence. So I have been leading large-scale projects at the government level as well of AI, and I have led some B2C level projects, B2B level projects, specifically in machine learning, data science, and artificial intelligence. So here I am. I've been involved in healthcare projects as well. So yes, thank you for having me once again.
Thank you for coming. And then Omar Ahmad, short introduction by you, please.
Sure, thank you, Gleb. Good morning, everyone. My name is Omar, based in Chicago. We have a Medicare healthcare product, which is 360 Healthcare. What we do, it is a remote patient monitoring. As an AHA, American Health Association is also enforcing a lot of things, which we did a podcast yesterday, that they are trying to get into the home healthcare and also taking care of the patients while they are home. So Medicare introduced a program, remote patient monitoring, and we have made that product 360 Health Tech, which is built with the IoT devices. So we will cover some of those topics today, and as we progress, we will introduce you a couple of the new features and how we are introducing AI in our healthcare products, especially remote patient monitoring.
Okay, great. So now that introductions are out of the way, we can actually start talking about AI and future of AI in healthcare. So let's dive in and ask a few questions from our experts. So the first one is, so with this AI, without AI developments and AI developments, especially in healthcare, how can AI help in predicting health issues before they occur? And what impact will this have on early disease detection, especially in remote patient monitoring?
Yeah, right. So, artificial intelligence has made, a significant strides, I would say, in healthcare, particularly in disease prediction. And so how it works, basically, the disease prediction is basically, first of all, you have to collect the data, which is very essential. You need to have the past data. So how this is collected, one of the major role that, our RPM has played, the wearable and remote monitoring devices. And then, you also have the electronic health records, and then you also have the, the imaging data, and then, the lab results and genomic data. So once you have all that data, then it's basically the feature extraction. This is where, you extract different values, I would say. It's, particularly supervised learning. So for example, you extract like age of the patients, gender, BMI, the cholesterol levels, blood pressure, and so on and so forth. So once you have those features extracted, then it's basically the training of the model begins. The data model, the machine learning model that you're building. So this is where the training happens. So there are different types of, learnings the models can have, like supervised learning, unsupervised learning, and then the deep learning. So once those models are trained, and then there's some testing that is being done, and then after that you are basically onto the the prediction and early warning. So those models, once they are validated, so then they are fully deployed, and they are basically capable of predicting the diseases before they actually occur. So for example, taking an example of cardiovascular disease with AI. So first of all, the data is being collected, like the data could be the demographic data, like age, gender, ethnicity. Then you have the health records, like medical history. So it's basically cross sources, multiple sources of data which is merged together, correlated, and features are extracted and patterns are identified that what situations led to this disease. So, once the model has learned, it is able to predict. So other examples could be like health records of like medical history, family history, heart disease, and then the vitals like blood pressure, heart rate. So this kind of stuff, once you have it, and then the variable data as well. So again, like I said, the features are extracted. We call it feature engineering. So once that is done, then the models are trained, and then the models are tested, and then the real-time monitoring and prediction can happen. So because when the data is coming on real time from those RPM variable devices, the AI has the capability to basically use its models to predict on real time with the streaming data, the real time data that is coming in, that this patient can have a risk of a heart attack, in the next couple of hours maybe. So this is how it's done. And so if the neural networks basically has played a vital role in this. One of the models which is very famous, it's called CNN, which is convolutional neural networks. So if I conclude my answer, it's basically the AI's ability to predict diseases is basically grounded machine learning techniques that analyzes the massive data set to uncover hidden patterns. So AI can save lives, identifying at-risk patients and enabling early interventions, like ultimately shifting healthcare from the reactive treatment to proactive treatment.
And I just want to follow up on this. So you're saying that AI can be trained on the data, and if you give it a lot of data, it's going to get trained. But individuals, everybody's they have different backgrounds, different diseases, different problems, and everybody's personal. So that's my kind of like my concern about AI. Like maybe something that can be bad for me, it's good for somebody else, or vice versa. So that is kind of my concern: is how can AI provide personalized healthcare recommendations, like based on this individual patient data, like individual specific just to me?
Yeah. So when I'm saying the learning, when the models actually learn through supervised and unsupervised learning, so it's basically when we have lots and lots of data. The more data is better for us in more situations. So once you have data, and what is that data? The data of the patients that actually had those combination of vitals and combination of conditions which led to that particular situation. So what happens is basically once you basically compare this new patient's data on real time with those trained models, whenever it matches with using any of those algorithms which I mentioned, it basically triggers out that yes, there is chances, and then it also shares the probability that this is this much % likely to have this. So this is how basically it's calculated. And there's supervised learning, there's unsupervised learning, and then there's another one called reinforcement learning. There's basically a reward system. So it predicts when the answer is correct, it gives it a score, a positive score. When the answer is incorrect, it gives it a negative score. So this is how it keeps improving its accuracy with the passage of time and more and more data.
So you just said that data is good, and I know that more data is better, but at the same time, like I don't think that healthcare professionals, my doctor, my nurses need all this information from me during the day, because most of the time it's just irrelevant, because like most of the time it's just like there's nothing bad happening to me. So in that case, in that sense, I just want to ask, what's your opinion on how can AI help reduce this amount of information, amount of kind of, in my opinion, irrelevant information to the doctors?
Yeah, so if I give you some of the examples, like AI assisted radiology, for example. So in radiology, the burden on professionals is significant due to the high volume of imaging studies they must analyze, and AI can help by automating much of the image interpretation work. So how this works is basically in this particular use case which I'm giving example of is a CNN model. It's an AI model which is trained on thousands of labeled images of conditions such as lung nodules, brain tumors, or fractures. So these models learn to detect patterns in medical images associated with these diseases. And so the impact is this system can review scans in seconds, which is very unlikely for a human being, and which, highlighting areas that require a closer look. So the benefits is basically the efficiency, the accuracy, because it's AI based, so accuracy is much better because human beings are more prone to errors due to external factors. And then again, the reduced workload. So this really helps the healthcare practitioners reduce their workload and focus on the areas where they need to spend more time and emphasis. So yeah.
I think so. You brought a very good point. The AI is basically speeding the process of diagnosis.
Yes.
Right. And along with that, what the end results will be given to the doctor much faster, where they can analyze and give the predictive reporting much faster, because now they have a help available, be the pre-defined models from where it is giving the results, and doctor will evaluate. Definitely FDA will come into this picture. FDA will start looking into it, that what is right, legal, and HIPAA laws also will apply into this. So this is a new discussion. We will do it later time, but all these things are important.
Yeah, so you see, Ahmad can't be quiet for a long period of time, so he wanted to jump in and talk a little bit. So why don't we switch our focus to him a little bit, and especially about 360 Health Tech. So. 360 Health Tech is the product of Omar that he's working on. It's IoT devices, and correct me if I'm wrong, it's IoT devices for Medicare program, and you're searching ways to implement AI in this. And I just wanted to ask you maybe a brief background and story about 360 Health Tech and some examples of how your solutions that from what I understand you already have implemented, how they transform the patient care.
Sure. So 360 Health Tech, we started this program 3 years ago. We are one of the very early entrants into this program. This is basically the guidelines provided by the Medicare. Medicare has started doing the remote patient monitoring, especially elderly people who are above 65 on Medicare. Medicare wanted that there should be a constant touch, and they don't need to come to the practice more often if we can manage them remotely. So they started the program, we looked at it, and then we took all the guidelines from the Medicare and converted into a technology. So right now, 360 Health Tech, three major products. One is glucometer, blood pressure, oximeter. These are three, and the fourth one which we are adding is a weighing machine. They all are IoT devices. They have SIM, which connects with the closest cellular tower. The patient doesn't need to do anything. As regular, if they are taking their glucose reading, they will keep on taking. If they are taking their blood pressure, they will keep on taking their blood pressure reading. But once they take the blood pressure reading, what it does, it just connects to the closest cellular tower, uploads the data into the cloud, and then we have our registered practitioners who are monitoring this data on regular basis. The moment they find any anomaly, if the blood pressure reading as prescribed by the doctor goes above or below, they engage the patient and then they engage the doctor. Also, by Medicare, they are mandated to talk to the patient 20 minutes to find out their health, find out what actually they are doing, or they have any issues. So this is all 360 the product is, and we call it remote patient monitoring.
And with remote patient monitoring, you explain what's happening today, but now as our podcast is about, this episode is about AI in healthcare, and I just wanted to ask you, what are the new technologies you're looking to implement or focus in the future?
Very good question. Gleb, this is an AI era, right? Automation, find out more faster, get more predictive answers, and improve the quality of our diagnosis with the patient and the doctor. So I definitely asked Umar, I know he's an AI expert, that how he can come and help us with AI, where I think Umar just discussed before, AI is good when it has a data. So now we have 4 year worth of data with us. So we have asking Omar to come and help us to analyze the data, give some more predictive answers where our nurses can be more proactive, look at the results and get better, faster results and engage doctors and give better support to our patients. So that is our next phase of our product, is to make it AI aware, AI driven automation. So that is the task has been given to Umar. So this is what we are doing with 360 Health Tech now.
So, Mr. Chaudhary, I want you to comment a little bit about this task and just explain what Mr. Ahmad just said, and how, in your opinion, again, AI systems continuously learn and adapt to improve the effectiveness of products like 360 Health Tech.
With the coming of these large language models, like we have this chat GPT or Copilot, and then we have these open source technologies like Llama. This has enabled us to use natural language processing more effectively. So one of the most effective use case is basically assisting the healthcare practitioners who are basically monitoring the RPM data in real time, and they're always available, but they have to see lots and lots of information on the for example the dashboards. But what if they are able to chat with the system and ask specific questions, like I want to see what has been the highest blood pressure rate for patient XYZ in the last 1 week. So instead of just playing around with the data or even playing around with the charts or in dashboards, they can just simply ask this question as a prompt, and they're going to get the answer out of your own data. So this is one of the use cases we are working on, and there are so many more. There are so many more.
I think so you brought good point, Umar, here. Not only it will help nurses, it will help the doctor. It will also help the patient. If they wanted to, if the patient is with the doctor, rather than doctor goes and browse around everything from the past charts, he can only ask one question through an AI model, that can you give me these statistics, and he can get those statistics, and in that way he can provide a better service. So definitely this is one of the very early features which we are testing in our product through AI. As we go along, we will learn from our data what we have, how we can generate better reporting, how we can generate better predictive analysis. Also, we are talking with the Omar and his team, is that the nurses talk usually 20 minutes every patient. That is required by Medicare. While they are talking, what things that AI can pick up from the discussion which can be helpful to the doctor may not be properly highlighted, because 20 minutes of discussion during period of time is very scattered. But if AI can pick up a specific information from there, make it available in a summarized way for the doctor and the nurse, can be very helpful. So all these, and trust me, we could have not thought of this feature functionality 5 years ago without AI. There is a lot of QA teams need to be sitting and manual work need to be done, but now it can be done much faster. That's why we're able to do it. So thank you, Omar, for all the support and help. I think so we are going in the right direction.
Yes, we are.
In our future podcast, once this model will be more matured, we will come and do a small demo and show that what we have done with this data and how Omar has incorporated AI into the remote patient monitoring program. We have one more program, CCM is coming up. We have huge data for CCM. That will be the next one where we'll be engaging Omar and his team to get more information.
We're talking about personalized healthcare recommendations. So, just to assist the healthcare practitioners, the nurses, for example, the personalized meal plans is one such example for, let's say diabetic patients. Like, AI can simply recommend specific foods and portion sizes that keep glucose levels within a safe range. and then also the exercise recommendations, and then also the medication adjustments. If the AI detects the glucose levels are consistently, high after meals, so it suggests, adjusting insulin dosage or switching to a different medication, depending on the patient's response to the current treatments. So, this kind of amazing work this AI can do, and that's what we are working on.
Yeah. So a lot of exciting news. First of all, thank you guys. A lot of exciting news. Well, you heard it here first. A lot of developments in AI and in 360 Health Tech as well. I'm really looking forward to have future episodes, future podcasts, and we'll definitely have Mr. Chaudhary back to address more questions by me. Thank you very much, and I'll see you soon. Bye.
Thank you, everyone.
Thank you for having me. Take care.
Bye.
Bye-bye.